Hello, it's Brian Liberty, and in this video I'm going to answer the question, what is antisocial personality disorder? Okay, here we are. We're going to discuss what is antisocial personality disorder. But before I get to that, there is a little disclaimer blurb kind of thing I like to do here. I do have notes below here I'm going to be referencing constantly throughout the video because personality disorders are complex and I don't want to lose anything here. But the first thing that I want to say is that this is not diagnostic criteria. This is not meant to diagnose anybody. It's just a description to point you in the direction of what may be going on if you feel like there's antisocial personality disorder happening in yourself or someone that you love. A trained clinical professional should be able to diagnose you if that's something that you need, but do not use this information to diagnose anybody. This label of antisocial personality disorder, if for some reason that bothers you, it stresses you out, it doesn't help you in your own healing, then let the label go. It's not necessary. This is just to point to a set of stuff that's going on when we talk about antisocial personality disorder. A personality disorder is not something that's unfixable. Personalities can be modified, they can be changed over time, and researchers are always learning new information about personality disorders. So don't think that if you hear this and it sounds like something that's going on with you or somebody else, that it's set in stone and there's no changing it. Personalities are definitely malleable. They can be molded and changed. And the last thing I want to say is that people with personality disorders, and including people with antisocial personality disorder, they're not inherently bad or evil. That's just something that unfortunately stigma's out there about people with personality disorders. I wish it wasn't there. I wish we could just get rid of it, but they're not bad, they're not evil. They do sometimes, however, especially in the case of antisocial personality disorder, and we'll get to that, have manipulative and maybe even abusive ways of behaving in the world. So if you are somebody who's in a relationship with anybody who's an abuser, who manipulates or harms you, I would encourage you to take steps to distance yourself from that person and get yourself the help that you need, and not worry so much about the person who has the personality disorder. Just take care of yourself when you're in an abusive relationship. That's what it comes down to. So all of that said, let's get into what antisocial personality disorder is. It was previously known as psychopathy or sociopathy or also dissocial personality disorder. Everything's kind of combined now into antisocial personality disorder. It's something that starts around 15 years of age, and it reaches its full maturity at age 18. Starting on or before age 18 is when you see this is antisocial personality disorder happening. So things that characterize antisocial personality disorder, also known as ASPD, is that they repeatedly ignore social norms, particularly laws. So you may find that they have an arrest record. They lie, they use aliases, they con other people. It's all about exploiting other people. They are impulsive and they don't plan ahead for things, very spur of the moment, like, oh, I'm just going to go out and hurt somebody today, or, I just want to rob a bank today, or I'm just going to fly across the country, I'm going to quit my job, all those kinds of things, just very sudden, very impulsive. They typically have aggressiveness, and you'll see this because they get into physical fights or they assault people. They have a disregard for the safety of people, including themselves, so they just don't care about your safety or their own safety. They're just kind of acting and being the way they are in the world without any regard to that. They are consistently irresponsible as a result of that, and you'll find that they don't fulfill their financial obligations, they don't fulfill their work obligations. Like I said, they may just quit suddenly out of nowhere, they may just not come into work. There's just no regard for any kind of structured rules like that. There's a lack of remorse for having hurt or mistreated others. They very often rationalize why they hurt somebody else, or they just act like it doesn't matter. It just doesn't faze them at all. Their self-esteem comes from power, pleasure, and personal gain. They get like a little bit of excitement and a little bit more good feelings from that. Their goal settings are all egocentric. It all revolves around themselves. There's no pro-social standards inside of them. There's nothing inside them that indicates that they should cooperate with larger society. They have an incapacity for mutually intimate relationships. They can't have a good, healthy, intimate relationship because they're always looking to exploit other people. So there's no common ground between them and somebody else. They're always going to manipulate and exploit that person. They're dominant and they intimidate to control other people. They're always trying to get one over on somebody, get control of them, feel larger than them. They use things like charm, seduction, and glibness to manipulate people, so they're very often likable, happy, exciting, mysterious kind of people, and that's all part of how they manipulate somebody. There is very often persistent anger in response to very small things that they feel slighted by. And because of that, there's a lot of vengeful behavior, seeking revenge, getting back at somebody. And they'll take delight in that very often. So prior to age 15, in somebody that has antisocial personality disorder, you'll find that they had conduct disorder. And this is not something that occurs during schizophrenia or during bipolar disorder, so you got to rule that out. They are a population of people that are more likely to die by violent means than the general population, which is kind of interesting, something to note. The good news about all of this is that there is treatment for people who have antisocial personality disorder. That is cognitive therapy. There is psychotherapy, as long as it is not exploratory or insight-focused therapy. Those don't seem to work with somebody who has antisocial personality disorder. There is group therapy, as long as it's in a group of other people with this disorder. So you can't commingle disorders or commingle with a general population. It has to be all people with antisocial personality disorder for a group setting to be effective. And also family therapy can be beneficial just to educate the people around the person who has antisocial personality disorder. So all of that said, what does it feel like to have antisocial personality disorder? Well, as far as I could tell, I couldn't find any way that it really shows up in the things that you feel inside your body. But as far as your thoughts, you may have those superficial rationalizations, small like excuses to justify why you hurt people and why you do the things you do. Things like losers deserve to lose, or life is unfair, or blame. You may find that you blame victims very often, like she had it coming to her, or he was asking for it. You may believe that everyone is out for themselves, and you have that kind of it's a dog-eat-dog world mentality. And you may think highly of yourself because you do manipulate people and you take pride in that. Now, the emotional side of this, generally there's just a background anger and frustration and vengefulness, and often there's boredom when that's not present. So the two options for somebody with antisocial personality disorder in general are either to be angry or bored, and you'll see this is why they often choose angry, because it's better than being bored in their mind. Behaviorally, you'll find that somebody with antisocial personality disorder is often blaming other people for their behavior. They get into fights. They manipulate and exploit people using that superficial charm that we talked about. There's risk-taking to avoid boredom, so anything exciting and daring. Again, impulsive. It doesn't have to... If it's dangerous, it's exciting to them. It doesn't matter that it puts you or them at risk. They're gonna go for it. Just to feel something, just to not be bored. They are not going to follow through on promises very often. They will lie. They may hurt animals. They may have reckless driving, reckless sexual behavior, many sex partners, for example, substance abuse. They may steal, destroy property, break laws, They make a lot of spur-of-the-moment decisions. Like I said, maybe just quit their job one day and move across the country out of nowhere. And very often, because of all this stuff that's going on, you'll find that they're poor parents of children. They can be neglectful or they can be abusive. So, like I said, there is treatment for this. I know it all sounds kind of overbearing and terrible, but people can get into treatment for this and manage a lot of this down. So don't worry if this sounds like it's something that's going on in your life or the life of someone you loved. Just make sure that somebody gets into treatment. And I'd love to know what your thoughts on this. If you've had any experience with somebody like this, what has it been like for you? What have you found has worked to help in this kind of a situation? Leave those comments below. And I hope I've given you a good human perspective on what antisocial personality disorder is. I thank you for your interest in it, and I thank you for being here with me. Hey, it's Ryan Liberty. If you liked that video, please give it a thumbs up, share with a friend, and leave any questions or comments down below because that would really help me out. If you're somebody who's gone through a traumatic event and you're feeling cut off from the people around you, I have a free course that will help with that, so please click to get it. And if you'd like to see the rest of my videos, please click subscribe. As always, I want to remind you that your life matters. Nobody can question your worth. However it is that you're feeling, whatever it is that you're going through, it's okay, and you are loved. Thanks again for watching.